It is my great pleasure to welcome you all here today for the 11th Annual IPE Day. For the past 11 years, IPE Day has brought together students and faculty from across the health, law, and human services schools of the University of Maryland, Baltimore.
I know how interprofessionalism makes my practice better. I really learn every day from my colleagues in nursing and dentistry, pharmacy, law, social work. I learned from all of them.
The focus today is not on getting the diagnosis correct or figuring out the problems that they're having, really focusing holistically as a group, interprofessionally, on what is affecting this patient's health and how you can work together as a team.
Welcome to the clinic. I'm Priya.
I think an important thing for SPs to realize is that it's not about the acting per se, it's about helping the student prepare for when they're an actual caregiver.
Would it be okay if we get some lab work done today?
And it's a difficult job in the encounter because you have to kind of do two things at once. You have to portray the patient the way it's written in the script, but you also have to, in the back of your mind, think of what the student is doing well or what the student could do a little better if they had an opportunity. What we're trying to do today is have enough issues that every student in IPE Day can address.
You have type 2 diabetes, which is a bit uncontrolled at the moment.
It does feel like we're really helping in our way to help the future doctors, nurses, pharmacists, lawyers, social workers of tomorrow to improve their skills in a setting that's safe. Each individual, like I said earlier, I felt very well taken care of. I mean, everybody really seemed to want to help.
Did you get a taste of what it's like to work with a team and then give that information to the patient and think collectively?
I agree. I mean, like,
Yeah.
coming from my side, like, dentistry doesn't really, we're kind of like on the edge of things,
Uh-huh.
kind of the forgotten child of medicine. But
No.
it was really nice kind of working with everybody because we do work a lot with blood pressure and diabetes and stroke. We do
Right.
pay attention to that. It is very important to us. So we usually have to refer out, and it's just nice to work alongside and get that information right then and there.
So in terms of what the students take away from IPE Day, I think they've been given a taste of what it means to work as a team in a simulated environment, and hopefully that inspires them to seek out other interprofessional activities on campus and in their work life.